another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Tammy Kohlschmidt speaking on thermography for health. Tammy Kohlschmidt is a certified clinical thermographer and a front-runner as a licensed dental hygienist. She has special interest in the oral systemic link and in non-surgical periodontal therapy using lasers. By combining thermal imaging and periodontal therapy, she's made connections between the mouth and body that address the oral systemic link. Tammy believes the mouth and body share an ecosystem that must be treated as a whole to obtain sustainable health. Tammy has intertwined her intuitive healing abilities and her love for energetic medicine as a certified body talk practitioner. She's also trained in nutritional evaluations using the Zyto technology. She's integrated thermal imaging, periodontal therapy, energetic and spiritual healing with nutritional evaluations as a better way for sustaining health and well-being. Tammy believes that health and well-being is a reflection of spirit, belief systems, energetic fields, body structure, and body chemistry. Tammy is a founding member of the American Academy of Oral Systemic Health. She's a member of Dentistry for Diabetics, Centers for Dental Medicine, Thermography Unlimited, and the International Body Talk Association. She's co-hosted a national radio show on sustainable dentistry. She teaches and lectures on thermography and is currently co-hosting the show Sustainable Dentistry, A Better Way with Dr. Reed Winnick on Manhattan Cable Channel 57. She continues to attend courses and workshops from the Holistic Dental Association, the International Academy of Oral Medicine and Toxicology, Zyto Premier Research Labs, Simply Vibrant, the Integrative Health Symposium, Chirodontics, Intragra Med Academy, Body Talk Modules, Carolyn Miss, Gabrielle Roth, Sharon Salzberg, Eckhart Tolle, Deborah Ford, Krishna Das. Tammy's free time is spent as a dancer, choreographer, and dance instructor. For more information, visit her website at thermographyforhealthny.com. Welcome, Tammy, to the call. I'm so excited to have you on the show today.
Thank you, Dr. Brayton. I'm happy to be here.
So Tammy has her practice called Thermography for Health, based in New York City, and I've known her for a while now because she's located out of my holistic dentist office, and I'm really excited to bring some awareness to the women listening today about this type of work of thermography, because I feel like it's not very well known, and I think it's such a valuable tool for learning more about what's going on in the body. And so I think it would be just great to have you share a little bit about what you're doing. So let's just start off with describing about what is thermography.
Okay, so thermography is a functional test, whereas the tests we're most familiar with are mammograms and ultrasounds. Those are anatomical tests. So when you have either one of those tests done, the technician is actually looking at your anatomy. It's because mammograms are radiation, so they're looking for calcifications. They're looking for hard spots in the anatomy. Where thermography is a functional test, there is no pain, there is no body contact, and there is no radiation. So it's non-invasive. It's very safe. And what functional means is when we look at the imaging, we want to know just that. How is your body functioning? Because if you are in dysfunction, then you are on the path towards disease.
Right.
So with thermal imaging, we're able to look at blood flow, lymphatic flow, digestive stagnation, nerve flow, and hormones. And that's just like the tip of the iceberg there. But those 5 things dictate how you are functioning and how healthy you are going to be, if not right then, but in the future. And the thing, my tagline with thermography is, thermography allows you to see what you may not yet feel. And the reason I try to get this point across to women and men is that just because you don't feel something going on doesn't mean that it's not there. And thermography is a tool that can catch the disease process very early on. And why that is because we're looking at inflammation. And inflammation can be like a slow burning flame that you don't feel until it becomes a full-blown fire. So that's the whole key. It's detecting early, using preventative measures, and then the third thing is teaching the patient or the client self-care. Because you don't want to just go in for a test, get handed results, and then you're done. You need some guidance on how to take care of yourself after you get your results.
I love that. So I really love this concept that it's a function. Number one, it's a functional test. It's not waiting until cancer has now created a tumor within your body, but it's actually an opportunity to see areas that are hot, right, or like kind of inflamed on this thermography scan. And that brings an awareness to somebody that whether they're having symptoms or not, that area is having dis-ease, and it certainly can create something more ominous like a cancer tumor or some other sort of autoimmune or other type of health diagnosis down the road. And we don't have to wait until you actually have a full-blown diagnosis in order to make changes in a more preventive manner based on the information from the thermography.
Correct. That is totally true.
So that's really exciting. I feel like it's an opportunity for a patient to really feel empowered about learning more about what's going on within their body, getting more information. You know, I certainly have always been preaching that, you know, health is not the absence of symptoms, which is what I'm hearing from you.
Yeah.
You know, thermography is able to find things whether you're symptomatic or not, and based on that information with some education that they receive from the thermographer, they're able to make lifestyle changes that are going to help reverse that inflammation or the disease within their body, allow their body to heal itself, and that diagnosis will never actually manifest, which is really exciting to put that type of power into a patient's hands.
It is, and I think the key thing that you said, that you did bring up, is empowerment. Because if you don't start to take responsibility for yourself, your health, your well-being, your daily rituals of self-care, disease is inevitable. Okay, it just is. If you don't have a handle on that, the chances are you will end up with some sort of disease of, you know, it's a plethora. For women, the number one disease is heart disease, and that has a lot to do with emotional and mental stress and tension. But, you know, empowerment is the key to becoming healthy or even reversing a disease if you have one. You have to learn how your body functions and what is best for you. And that's why I fell in love with thermography, because it's a tool that I can use to help guide someone and show them the differences 3 months down the road when we do a re-imaging. You can see the change. And oftentimes, if you go by what you're feeling, you know, when we're stuck in our lives, we don't even know that we feel bad. We might kind of have an inkling of it, like a hint of it, but man, when you start to take care of yourself and you start to feel good and you look back at the way you used to feel, it's shocking to realize that you didn't even know how bad you felt. That makes sense.
Yes. Yeah, I see that so much in my practice where patients are really just barely functioning, but that's become their normal. So when they actually start to function normally and be in alignment and move and eat and talk and sleep and digest normally, they feel so good. And that's actually what normal is. Like, it's normal to actually feel completely alive and vibrant all the time. And sometimes we actually forget what that feels like if it's been a long period of time, which unfortunately for some women that's the case, is they really kind of forget what normal is, and they just have adopted their current condition as their normal. And so this is a great tool to bring an awareness about how to make a shift and why that shift is important. And I love that you were able to do, like you said, a rescan and a follow-up. So there's also that, you know, objective findings that can show the change that's happening within the body based on the lifestyle changes that that person's making for their health. And that's got to be exciting for a patient to be able to see that before and after as well.
It is. It's truly exciting. I mean, I just recently, I would say the year 2015, someone very close to me was dealing with breast cancer. And it's hard, but I'll tell you what was hard was she's not a holistic person, okay, at all. She's not into health and wellness, nothing. But I brought her in. I said, we need to do thermography. We need to see what's going on with you, because every time I seen her, she kept complaining of pain in her abdomen. Now, mind you, she wasn't on any kind of healthy diet. She was just mainstream, living her life however she wanted. And I thought, okay.
Going through cancer treatment? Like, was she getting radiation or chemo?
No. This is pre-knowing anything.
Oh, this is before her diagnosis.
This is just me knowing her as a person. Okay. And her telling me that she always has abdominal pain, and but I can tell you, her personality is so vibrant and so alive. You would never know that she really had anything wrong with her, because it was pain, and she would just move through it. I said, you have to come in. We have to do this. So I did a women's health screening, which is a very encompassing screening. It's looking at the thyroid and the spine and the mouth and the head. I mean, it's pretty much your whole body. Mm-hmm. And I got to the breast, which I always image last, and I can't tell you the way that my heart sank in my chest. And I sort of grabbed my breath, and I thought, there it is. And I just, again, she knew nothing what thermography was, and I just got her, out of the room and prepared her, and I called Dr. Melvin. I was like, you got to give me a read on this right away. I need to know exactly what's going on with this person right away. Dr. Melvin's the reading doctor. So
I see.
He sent over the images, and he's like, this isn't good. And I said, I know that.
Right. So right away it looked like a cancer diagnosis.
Oh, yeah. It was unmistakable from what I could see. But the thing that everyone has to remember is that thermography, mammography, and ultrasound is never diagnostic. By law, you cannot make a diagnosis of cancer with any of those screenings. You must have a tissue biopsy. Mm-hmm. That is the law. So no one can say you have cancer until you've tested those cells.
Got it.
So you have to it's a fine line of walking and being careful with what you say to people, and because instilling panic is also not the way to go, and anxiety.
Yeah, but just encourage, making sure that that they're aware that this additional test is necessary. They need to get that needle biopsy done.
Yeah, and I have to say that a biopsy also is very controversial, and it's not always something that Dr. Melvin would recommend, or any doctor who is holistic would recommend, just because you do take a chance of the cancer spreading.
Spreading it, sure.
So there's a lot of controversy around that. Anyway, back to the story. So I told her, you got to get to the doctor. And I said, in that pain in your abdomen, we need to have a serious sit down and talk about nutrition immediately. And I'm like, it's the obvious. The first thing is there's no gluten, there's no dairy. And she's like, well, what's gluten? And I'm like, oh boy, we're starting from the square one. And then I said, get rid of that soda in your hand. I don't ever want to see it again, So this was like a big project. Anyway,
you could see the inflammation in her abdomen on the thermography.
Yes, I could see the inflammation. And I will tell you that one of the things that I do whenever I do breast imaging, I always image the digestion, because you cannot make a proper assessment of someone's breast if you are not looking at the gut, because that is the bottom line where most people are in dysfunction. And if you have gut issues or even mouth issues, there's a direct correlation to cancer of all kinds. So, looking at the gut has got to be a priority. It can't just be breast. You have to look at both.
Right.
If you want to be proactive and do something positive, with your path. So anyway, 2015, this was in the very early of 2015. So the whole year was just training her and teaching her and supporting her through.
Was she open to making changes in her diet?
She was. She was open. She was just no one's ever told her any of these things before. She had no idea.
Yeah.
So she's been learning. She's been learning so much. She's just to the point where I think it was a little overwhelming, but I really would not give up on her, and I made sure she got it 100%. Anytime I seen her with a plastic water bottle, I'm like, I've told you 6 times to buy a glass water bottle.
Estrogens.
Yeah, exactly. I'm like, I'm dead serious now. You're not leaving my presence until you go on Amazon and get your glass water bottle. So it was an amazing story of just turning someone's life around, and watching her go through cancer. She opted out of radiation. Of course, they wanted her to do it, but she said no. She did do the chemo. Again, that's controversial because there's a lot of information out there that says chemo is not really the way to go for certain breast cancers.
Mm-hmm. What about surgery?
She did do surgery, and I actually would have wanted her to do surgery because it was pretty bad. Pretty bad, yeah. Yeah.
She had a bilateral mastectomy?
Yes, exactly. Yeah. And that in itself was just an emotional roller coaster. And so we worked with tools, right? We looked at her life. We dealt with her nutrition. We dealt with her sleep. Come to find out, she has sleep apnea, which is a total cause of inflammation. Yeah. So we dealt with her sleep. We dealt with exercise. We dealt with her mental and emotional issues, which that came across with Body Talk. I did work with her with Body Talk very closely. Mm-hmm. And for those of you who aren't familiar with Body Talk, it's a form of energy medicine. It's a way of healing, but it's a way of tapping into a person's subconscious and sort of digging in to the depths of someone's soul, to the depths of their psyche, where they need the most help, but they don't know it. Mm-hmm. And what Body Talk does is it unravels these messages that the body has been trying to give you, and it leads you down the path of healing. So it's like energy medicine, and it's done with some tapping, and it's a very enjoyable experience. But that was what we did for emotional and mental support. Because when you're going through any illness, you can't just throw supplements at someone and fix their diet. That's just one piece of the puzzle. Mm-hmm. You've got their mental and emotional state, their spiritual state, their belief systems, and you've got their structure. I had her seeing a chiropractor, doing body work. Yep. It becomes a complete whole picture of your body. It's not just the chemistry. Right. You have to do structure, you have to do chemistry, you have to do energy, you have to do the mind. It all comes into play. Mm-hmm. So it was very interesting. Makes sense. Yes. Yeah. So it was a very interesting case, and how is she doing now? She's definitely on the mend. Mm-hmm. Her hair's starting to grow back, and she's deciding if she wants to just stay bald because she really likes the way it looks, and she's beautiful. She's beautiful. I mean, so, we're dealing with that now, like hair or no hair. Has she had a repeat thermography done? Not yet, because she has to have yet another surgery, a reconstruction. Right. And so you'll wait for after that. Yeah. Heals. Yeah. I mean, we could have done repeat thermographies in between, but when I tell you, it was hard to get her. There was so much that I needed her to do. I wasn't even so concerned about the repeat thermography as much as I was getting her to wrap her head around this new lifestyle. Yeah. Oh, and the biggest was quitting smoking. Oh, man. She's a smoker. Yeah. Yeah, but when I tell you she was like just mainstream, no clue about any of that type of thing, it was a huge undertaking. But she had to have known that smoking wasn't good for her health. Yeah, but it doesn't matter. People do things because they enjoy them, and often many women let things slide. They just do because they need a coping mechanism. It's not in their face, like they can't see sometimes the stuff going on internally. Yes, so that's why thermography is so great. Right, and that's the cool thing. So this woman had no idea she had cancer. It sounded like it was beyond the stage 0, stage 1 as well. So this is something that had been progressing. It takes years for cancer to develop to that level. That's right. So this has been going on in her body. She had no idea. She was having abdominal pain, which was a different part of her body. But and definitely involved part of it.
Yeah, that the thermography was able to, give her the information she needed to, first of all, address the cancer, and then secondly, change her lifestyle to help every other part of her life, body as well, and help her get healthy and heal.
Yeah.
Wow, that's such a cool story, and that is really powerful. So I would love for you to tell our audience, how did you find out about thermography, and why did you decide to become a certified clinical thermographer?
Oh, okay. So, let's see. I started off as a dental hygienist looking for a dentist who knew how to work with herbs and essential oils, because I didn't want to work in a regular dental practice where they were using fluoride and all these toxic chemicals.
Right.
Because my history through my entire life, I've had a huge struggle with my health. So I finally figured it all out and realized that I'm going to be a practitioner, and I'm going to do it the way that I know it needs to be done, which is the holistic route.
Yeah.
So I found Dr. Winnick, and he's one of the best holistic dentists I've ever met, and I've met quite a few.
He's amazing.
But anyway, so we teamed up, and we started this whole perio program, non-surgical periodontal therapy with laser and ozone and all these ways of healing the mouth. And I kept thinking, because I'm looking in mouths all day long, which, by the way, is an amazing thing, because your mouth mirrors the rest of your body. It is a barometer for what is going on in your gut and almost everywhere else, because every meridian in your body is connected to a tooth. So if you keep having issues with that breast tooth, okay, then I know that we need to maybe take some thermal imaging of the breast. So I'm starting to put together all these pieces as a hygienist. I'm realizing there's got to be a way that if I'm looking in someone's mouth and I see all this inflammation, there's got to be a way for me to look deeper into the body and make connections. Not that I'm going to be a doctor and heal these people. No. What I want to do is I want to gather the data, and I want to guide them into the next step, the next direction. Which practitioner should they see? Because it might just be a chiropractor, or it might be a nutritionist, or, there's all types of ways to go about it. Right. So I started digging around, and another hygienist who is of like mind in California told me, she's like, you got to check out thermography. I'm like, what is that? And this was years ago. This was back in 2008. Mind you, thermography has been approved by the FDA since 1982 for the.
Oh, wow.
Yeah, it's not a new tool. It's just been suppressed.
Yeah.
And we all know that.
Suppressed.
Yeah. So I told Dr. Winnick, and we got all excited. We went to California, we trained, we brought it back, and I thought, this is the start of my new life, because now I'm going to have my own business, and I'm going to figure out how to correlate the findings in the mouth with the findings in the body and, get some things done. That's what I was excited about. And giving my past health history, and my mom, who is a breast cancer survivor, I remember how swollen her gums were all the time. And I'm thinking to myself, what is wrong with her? Like, what is going on that no one is catching, And sure enough, she had been getting mammograms every year of her life since she was like 40, just like they told her. And she got one at 50, and everything checked out fine, and she felt a lump. And she's like, the mammogram didn't pick up this lump, but there's a lump, and she's feeling it. And by the way, self-breast examination should be the absolute first thing you do every month before you even think about doing any of these tests, because no one knows your body like you. And it takes time to get to know your breasts, because they are lumpy and bumpy, and they feel different all the time. But you will be you are like your first line of defense. And it's true. My mom found her lump, and the mammogram missed it. And, she has that whole story of breast cancer, but she's doing well now, and now she refuses mammograms. She'll only do thermography.
Yeah.
And, but that's how it all like sort of came to be for me. And then I thought, once I got thermography going, I'm like, okay, there's other things that I can offer as services to help to help people heal. And then that's how I got involved with Body Talk and essential oils and, just started creating this business that I have, all based on self-care and guiding people.
Right. Wow, that's amazing. So once you decided, because you were already a dental hygienist, you decided you wanted to get your training. Can you tell us a little bit about what that training looks like to become a thermographer?
Yeah, I happen to have trained with Total Thermal Imaging. It's with Dr. Melvin, and also
and what
Dr.
type of
Ben.
doctor is he?
Well, Dr. Melvin is a chiropractor, and Dr. Ben Johnson is an MD. Mm-hmm. And I can tell you that Dr. Melvin has been reading thermal images for almost 25 years. Mm-hmm. So he's got so much experience in finding temperature differences and patterns and all these different issues. I've just learned a plethora from him. So he's the
And is he based in New York?
No, he's in California. He's in San Diego area.
Okay. Oh.
So that's where I got my training. And it's never ending. I'm always continuing to go visit him and stay training. But I think what makes a good clinical thermographer is having a background in anatomy and physiology, understanding how the body functions. Because there's a lot of thermographers out there who are just technicians. They just take your pictures, away you go. You get a report. You never see them again unless you go back to have, your next screening. You don't even get to talk to the doctor. It's just a test. Right. So there's mills out there like that, just like there is in anything. I'm sure you know chiropractors who just sort of crack the back and away they go.
Mm-mm.
We're
not talking about that on the show today.
But I mean, there's in anything you get involved with, there's like the C+, and then there's the A+ and beyond. Yeah. So you need to find a thermographer. Yeah, exactly. You need to find a thermographer that has a background in health, knows anatomy, knows physiology, knows how to explain what a trigger point is or, what a spasm is, because you're going to find those when you're doing your imaging. A lot of breast pain is lymphatic stagnation coming from a trigger point in the back of the neck.
Oh, wow.
Yeah, so there's all kinds of things that you really have to learn and understand. And if you're looking for a thermal imaging place, by you can obviously Google it to see what's available, but you should ask them, what is their prep sheet like? Because there should be a prep sheet. And what I mean by that is, no shaving, no showering, no deodorant, no lotions, no creams, no food, no caffeine. There's all these rules that you have to follow before you do your test.
Is that like 24 hours before? Or
yes, 24 hours. Right.
Okay.
Well, in some cases it's 3 hours. Like you can eat food that day, but you need like a 2 to 3 hour window before the screening.
Okay.
So there should be a prep sheet. The environment should be cozy and private and dark. Mm-hmm. There should be controlled temperature. If the room isn't cool, that's kind of a red flag, because you have to cool down for at least 10 minutes in the room in a gown before you do your imaging. So those are the kinds of things that you may want to ask questions about, like what's your procedure like? What is the temperature of the room? What is your background? You want to know what the technician's background is. Mm-hmm. And I've actually recently trained another hygienist to help me because the business is growing and it's wonderful. And I chose a hygienist because of our training. I know where we come from with anatomy and physiology, and we know how to make the connections to the musculoskeletal system. And so that's important to me, to have someone working who really has some good, solid foundation other than thermography. Because really, thermography is just about taking pictures. It's digital imaging. Anyone could do it, but it's what you bring to the table for the patient. That's where it comes into. And
I think that's such a good point you made. So let's say, anybody could just get these images done and no radiation is used to capture these images.
Right.
right? And then now you have this information and you want to empower a patient to be able to make changes. So you have to really be able to explain to them what's in the images and then what they can do holistically to make a change. So I know you mentioned like you're counseling clients on nutrition and diet. You speak to them about how they can use essential oils to help with inflammation, or body talk to help with any blockages in their subconscious mind. So I think that's so valuable, and it doesn't sound like every thermographer has that type of training.
No, they don't. But if they're smart, they'll refer out. And that's what I do, because obviously there's all kinds of things going on with this patient. I'll refer out for nutrition because I don't always have the time. So, I'll let that go. And plus, I don't do blood work or hormones, but the nutritionist does. So, and if they need that, then as long as you understand who to refer these people to, that's another important question is, do you have a resource, a referral base? Because that's important. I can't tell you how many women have come to me and said, I had my thermography done and nothing, there was like no recommendations, no guidance. It was just a piece of paper handed to them and they were sent on their way.
Oh.
So that's a little disconcerting, and I think you might as well have a mammogram or an ultrasound because that's the same thing.
Right.
You're just getting a test.
Let's talk about that. So a woman gets this test done, thermography, and let's talk about how that is a different, you mentioned it's a functional test, different than mammography or ultrasound. Mammography uses radiation in its imaging, and ultrasound has ultrasound waves. Both of those can be detrimental to the health of the person, and they have side effects, which unfortunately aren't really emphasized. I think when women are getting these tests done, there's not a lot of awareness of the side effects. Right. Are there any side effects to thermography with the actual test?
Other than being naked and cold for, 20 minutes? No.
Okay.
Nothing.
Love it. And then let's say a woman is choosing to not get mammography because she is concerned about the radiation that she's exposed to unsensitive tissue like her breast, but she maybe has a family history of breast cancer. Could she use thermography instead of mammography?
Well, yes, and I say yes only because that's what many, many women are choosing now to do. And the reason is, obviously, everyone knows that the radiation can actually make the tumor grow, and the compression of the breast can cause the cells to, the cancer cells to escape. So there's a lot of downfalls. So when we're looking at thermography, if Dr. Melvin sees something that really looks suspicious, he will recommend an ultrasound because you need to get some sort of anatomical test. So he will recommend an ultrasound, never a mammogram. That's not even in our vocabulary anymore because it's just archaic.
Which, by the way, I think a lot of women listening today may be shocked to hear that.
I know.
Do you mind just elaborating a little bit more about that? Because I think it's so important for women to know, because especially in the United States, there's a lot of brainwashing about, you're a woman, you're 40 years old, time to get your baseline mammogram. And this is even irregardless if there's a family history of breast cancer. So can you just talk a little bit more about that?
Yes. So as with anything, mammograms have been sort of the standard test in the cancer breast industry since I can't even remember when, right? Mm-hmm. Whenever it started back in the 50s, 70s. Once you make something be the only way to go, and it's the only test that you can do, every single person who ever goes through university, whoever becomes a doctor, whoever does anything is taught that. It's indoctrinated. I mean, it's part of what they must learn, understand, and do. Because if they veer off of that path, they could be facing lawsuits. they are putting themselves in danger by not sticking to the doctrine, by not sticking to what the medical association and the universities have dumped all their money into and said this is what it's going to be. Mm-hmm. So there's that. There's also the fact that they don't understand prevention and health the way that they understand disease. And mammograms fit into the disease model that we have in the West. It's a model of get your mammogram, get your ultrasound, get your biopsy, go to surgery, go to chemo, go to radiation. No one discusses choices. It's just this is what you have to do and this is how we do it. Well, thermography brings a whole other thing into the picture, and I've actually had doctors call me and say, and I applaud these doctors because they have actually said, I don't understand thermography. No one has taught me this. Can you enlighten me? Mm-hmm. That's what all doctors should be asking is, what is this? Why do my patients want to try this? Like, what's so great about it?
Right.
And I can only say that what's so great about it is it looks at the way the body functions. So therefore, it's looking at a health and dysfunctional process versus you have disease or you don't. Mm-hmm. It's not just black and white with thermography. It gives you a way to make changes in your life and reverse disease. Doctors, and I'm pleased, it's not all doctors. I'm going to say many doctors just know how to, prescribe the drugs and tell you to, eat a good diet, but they don't really know what that means. And then, make sure you sleep and make sure you exercise, but they don't really know what that means either. Because sleep, diet, and exercise is tailored differently for every single person. And that's why you need people involved who can help create proper programs. But that's really it for mammograms. And the bottom line is it's a multi-billion-dollar industry. And God
the mammogram
forbid,
industry.
Yes, the mammogram industry, multi-billion-dollar industry. So, if women start to change their mind and not do it, there's going to be some major money loss, and that's going to disrupt the whole system. And, thermography's cheap. You're not going to make a lot of money with thermography. You're just not. It's cheap. And with thermography, because they don't understand it, they don't know how to explain it to the patient, so it kind of makes them feel insecure. Mm-hmm. So you've got that whole situation too.
Right. Wow. I mean, it's really crazy. So, kind of what I'm hearing is there's this big industry out there who's really kind of, like you said, indoctrinated how medical doctors are trained as students regarding, and these are even like, GPs, OBs,
sure, everyone.
that are OBGYNs that are usually the ones prescribing the mammograms. And then culturally, women are like, oh, I know all my girlfriends when they turn 40, they're getting this mammogram, and then maybe if they have a family history, maybe they started at 35 or 30, but regardless, it's just kind of like it's the norm, right? It's like what we do, and the doctor writes the prescription, you get the exam done, and that's that. And no one is really talking about the concerns of why mammograms aren't entirely safe, which you've already covered, and how they're also not necessarily the best test, which you've also covered. So I think these conversations are so important so that women can really feel empowered to be making the best choice for their body and for their health, and regardless of family history, because that's what's really cool about epigenetics, where despite if you have the BRCA gene or despite if you have a family history of hormonal cancers, breast cancer, uterine cancer, ovarian cancer, you can still have a different outcome than your family members based on your lifestyle. And that's actually what's controlling and turning your genes on or turning your genes off.
That's right. Yes, and you know that there's many, many doctors who still don't even know that or embrace that. There's many, many doctors who aren't putting their mind into that thought pattern, or that training. Now, obviously our functional medicine doctors get it. They're on board. To me, they're the leaders in medicine, and I'm hoping that we get more of them with our younger generation coming up.
Yeah.
Because they hold the power. It's still a patriarchal society. It's still, doctor is, the last word for a lot of people. They think, well, the doctor said this, so that's what I must do. There's a lot of people who still have that belief system and live by those rules. Mm-hmm. And I do feel that mammograms are a patriarchal test. I mean, what man on this planet would ever put their testicles between two plates and squeeze them? Mm-hmm. There's other ways. There's other ways. Mm-hmm. So women, and this is just coming from an empowerment of, female, they need to start looking at their choices and listening to their intuition and doing what's right for them, not what the society has said you must do.
Yeah,
that's it.
It's so true. It's a big reason why I started this podcast, Well-Adjusted Mama. I want to get this information out to women so that they can really be making choices regarding their health, especially around, pregnancy and birth and child care. So let's talk about, since that's a lot of the women listening in, thermography, can that be used, let's say, when a woman is pregnant, for example? Is it safe?
I would say no, not really for the breasts, because the hormones are going wild, and you're not really going to get any kind of a baseline for the breasts with that. Mm-hmm. Mm-hmm. Because, if we had pictures, I could show you like a pregnant woman breast. There's so many blood vessels that you wouldn't be able to tell what would be a new blood vessel growth, because determining cancer with thermography is looking to see if is there angiogenesis, which is new vascular growth. That means there are blood vessels being laid down to support a tumor.
Right.
You're not going to see that in a pregnant woman. You're going to see blood vessels like crazy in their breasts. Estrogen patterns,
because they're pregnant. So what about a mother who's nursing? Probably the same thing, right? Wouldn't it be the ideal time? So thermography is really for a woman or a man. To your point, men can also get thermography done if they're just wanting to look at overall health and wellness and how to make changes in lifestyle based on where there's inflammation within their body. But this is done either preconception or after a woman is done nursing.
3 months after nursing, yes.
Got it. All right. Cool.
And by the way, it's 3 months after any surgery for anywhere in your body.
Because if you have surgery anywhere in your body, there's going to be that normal inflammatory response from the surgery, and you want to give your body a chance to heal and repair from it. So that's good to know that that's when you would want to get it done. And I also want to talk about the cost. So you had mentioned, thermography is inexpensive. How much does it cost?
Well, it's going to be different in wherever you live, but here in New York, if you come in for your breast scan, it's $250, and a new patient gets $25 off, so it's like $225. When you come back 3 to 6 months later to complete that baseline, it's $170. And at that point, if you're fine and there's no issues, it's just a yearly fee. It goes back to $250. Now, if you choose to do more encompassing scans, like a women's health screening, that is, women's health screening is $512, and then you get $25 off. And a full body, which is head to toe, hands, feet, the whole deal, that's $712, and you also get $25 off. Mm-hmm. But what makes my prices, what I've built into my prices, is that half-hour reported findings, the guidance, the education, the saliva test, because every patient that walks in for thermography gets a complimentary saliva test. I'm looking for oral parasites and any kind of overactive bacteria that would be causing inflammation in the mouth that they don't even know they have.
Right.
So I have a lot built into my fees.
Right.
It's not just you walk in and you get your images.
Get the test, and all of this is really valuable. Like, when I'm going to get my teeth cleaned at that same location, they're always doing the slide of my saliva and gums to look for, like you mentioned, infection and overgrowth, because that does give so much information about not only the health of my mouth, but the systemic health as well. So I think this is really valuable. And to your point, like, this is really not a huge financial commitment. I think sometimes the challenges with mammograms, because it has become part of our cultural norm, is it's usually covered by insurance. and I believe thermography is not. So this is an out-of-pocket expense, but you could use a health savings account or flex spending to pay for it, correct?
Sure. Yes.
Yeah.
Yeah, and I can tell you, insurance covers, a lot of what insurance covers, they don't cover the good things, is what I've found.
It's true. It is true.
Yeah.
So, yeah, I think this is, once again, being empowered, not having your insurance company make decisions for you about what tests you receive or which types of modalities and treatments that you do, but you're only because they are covered, right? So regardless of what's covered or not, you're making a decision hopefully based on this is what's best for me, and if it's not covered by insurance, like for myself, I don't expect my insurance to cover anything because it's catastrophic. So it would be covering a catastrophic event, which luckily, is not a normal part of my life. So the rest of my care, my dental appointments, cleanings, my chiropractic care, my acupuncture are covered through my health savings account. And that's important for people to know that that's available, and that's really an opportunity to cover your expenses and have money that's set aside specifically for that, and you can use it for thermography as well.
Yeah.
Yeah. So are there any last thoughts you want to share with our audience about thermography? And then I also want you to definitely share your contact information and then how a woman could find maybe a thermographer in her area as well.
Sure. I guess the takeaway from this is thermography can help you see what you may not yet feel. Mm-hmm. And that's the bottom line. You have to look deeper into yourself. Just because you don't feel something doesn't mean there isn't something brewing.
Right.
And it's best, thermography is best for early disease detection. That's where it highlights itself. But the other takeaway is lifestyle and self-care. I mean, if you learned anything from that little story I told you about one of my patients, it is truly about how you care for yourself on a daily basis. Whether it's eating, sleeping, drinking, relationship, mental stress, whatever it is, you have to look at all of it. And you have to start to fix the little puzzle pieces that are sticking out sideways and fit them back in. Mm-hmm. And that's really my message with all of it. To find me, you can go to thermographyforhealthny.com. Mm-hmm. You can also go to dentistryforhealthny.com. Mm-hmm. If you're interested in any of the oral stuff that I talked about. But as far as finding someone out there, you're based in New York City. New York City, yeah.
Yeah.
We're on East 56th Street, between Park and Lexington. But there's plenty of really good thermographers out there. I mean, I know some great ones down south and in Arizona and, of course, California. They're all over the place. So you just have to get on Google, see what's in your area, and then call them up and ask questions. Find out who they are. Tell them you want to read their bio, Really investigate what it is they believe in. Because whatever they believe in, that's the service that you're going to receive.
Right. And Tammy, would you mind if somebody lived somewhere else outside of New York City, if they contacted you, since you mentioned that you do know people all over the country, maybe you could make an actual personal referral?
Sure.
With their in their area?
Yeah. If you go to my website, there's a place where you can send me an email.
Yeah. That would
also
be awesome.
On my website, you can download a free chapter from a book called Breast Wisdom. And the chapter that is on there talks all about mammograms, ultrasounds, and thermograms. So it's a great, recap. And that book was written by Dr. Ben Johnson.
Okay. That's great for women to know that this is out there. And, if they are currently dealing with, some breast health issues, they have family history. I mean, it's just really become so epidemic to have, so many women are being diagnosed with breast cancer, right? It's really becoming, it's becoming more prevalent. So this is great to help us better understand why this is happening and the toxic factors that are in our life and how we can actually make changes and shifts on products that we use and how we spend our money to help decrease our toxic load I know that's been a big point in a lot of my other podcast episodes about being, spending money on products and services that are, eco-conscious and more, less toxic to our health and to the environment. It's a big thing.
Yeah, it is. It's everything, really.
Yeah, it is. Well, Tammy, thank you again so much for coming on today. And I just love hearing your passion for thermography. And, I need to make an appointment for myself. I'm realizing I need to get in there. I don't have to wait till my next dental cleaning either. So I'm going to come in and do my full body scan because I just like to get my baseline and see where I'm at. And I have no desire to get my first mammogram when I turn 40. So I'm not going to go there. I'm going to get a thermogram instead.
Yeah, I agree. Yeah, the more women that just make that decision consciously, there's going to be a shift. It's just going to take a while.
Yeah. So thanks again. I really appreciate it.
Thank you, Dr. Brayton.